Good evening, everyone. This is Brandy Fox coming to you live again with another episode of Be the Entrepreneurs Talk It Out, which is a solution based virtual chat to support minority entrepreneurs. What sets us apart from any other show that you will see on Facebook Live is the fact that we do not just talk about the issues, but we actually give you attainable steps to help you overcome the barriers that negatively affect minority entrepreneurs in particularly. So I'm super excited that you guys are joining us today. Today's topic is going to be amazing. We are talking about healthcare for entrepreneurs. Because I don't know about y'all. I don't know if y'all been in that healthcare market, but baby, I almost passed out because what they trying to charge me for healthcare as an individual, healthy female is crazy. So when I met with Miss Leslie, Ware, I was super excited about the opportunity to provide this information and let you guys know that there are alternatives for healthcare out there that you can get that's affordable and perfect for entrepreneurs who are on a either strict budget or a shoestring budget, or even if you got the money and you don't want to spend all the money that the marketplace is offering, we just want you to know there are alternatives for the market. So if you have not, please make sure that you share today's post. We want to make sure that we let all entrepreneurs know about what we're doing and what we're talking about and the best way to get healthcare for you as well as your employees, and if you have contractors as well. As I stated, our guest for today is Miss Leslie Ware. She is a physician's assistant, and you can follow her on Instagram at AHAWDPC. Now, we'll let you know she is located in the Charlotte, North Carolina area, but we're going to see if we can get some info on how you guys can find other physicians that may be in your area. The topics that we will be discussing today will be the importance of access to care, the concept of concierge medicine, and virtual membership based care. A little bit about me. I'm Brandy Fox, and I own Be the Entrepreneur Consultant Agency. And we specialize in strategizing, implementing, and empowering new entrepreneurs. We do this by transitioning your business ideas into real businesses. And we do this in four simple ways. Number one, we have our Institute of Entrepreneurship. It is our digital learning platform that walks you step by step through the entrepreneur phase, starting from your business vision all the way to how to pitch to an entrepreneur. Our next option is How to Start a Business in 30 Days ebook series. I have written 8 ebooks that cover everything that you need to be an entrepreneur, including budgeting, your business plan, how to pitch, how to determine your competition, and how to analyze your strengths, weaknesses, opportunities, and threats to make sure that you're effectively competitive in your market of choice. We also have our Be the Entrepreneur Academy, which is a one-on-one learning online curriculum where at the end of each lesson, you have the opportunity to meet with experts in the field. So for example, when you do our book for budgeting templates, you have the opportunity to get a session with a certified accountant, which gives you everything you need to be able to make sure that your forecasting is in place, your startup business budget is in place, and everything you need to adequately create a foundation for a successful business will be provided to you in this online curriculum. Lastly, we have Be the Tribe. That is our online hub for entrepreneurs who are thinking about entrepreneurship, but they're not all the way ready to make that jump. Every month, you'll get new templates, new tasks, live masterclasses to help you get your business rolling, but not have all the pressure of like, I need to start my business now. It might be, hey, I want to start my business next year. How can I get that preparation going? And you can find all of these services on our website at www.betheentrepreneur.com. And I will be placing it down in the comment area for you guys. Also, do not forget, this is a live session. So if you have any questions while we are talking, do not hesitate to ask them because we want to make sure that we are here to support you in your entrepreneur goals. What to expect today? A free Be the Entrepreneur consultation giveaway at the end of the show, This show is from 6 p.m. to 7 p.m. You're going to get organic solution-based discussions, action-based tips to help you overcome the barriers of today's discussions, and Q&A live where you can ask any of our topic-related business questions. That was just a quick ad from one of our sponsors, Pamper Us Mobile Massage Service. If you are looking for a mobile massage in the Greensboro Triad or the Charlotte metro area, Pamper Us Mobile Massage Service specializes in over 10 years of mobile massage therapy services and parties. So, without further ado, I am super excited to welcome my guest on, Miss Leslie Ware.
Thank you. Thank you for having me.
Yes, no problem. I'm super excited to have you on here. Um I feel like from the time I came into the doctor's office when we met, like we kind of clicked and I love what you're doing. I love how you're doing it. And as soon as we met, I was like, I definitely wanted you on the show to talk more about affordable healthcare options because even with you being an entrepreneur, you know how crazy it can be trying to balance everything that goes with being an entrepreneur, but then taking care of that healthcare piece as well. So I'm excited to have you drop some gems on everybody today.
Yes, I'm so glad to be here, and I am just so thankful that you found me. It's people like you who spread the word in this type of a business model that really makes the difference in how I grow my practice. So I'm really glad to just be a part of this whole experience, and thank you again for inviting me.
No problem at all. So, Leslie, the first thing we like to do when we welcome our guest on is talk about your motto. So, Leslie's motto is entrepreneurship teaches you as much about yourself as it does about business. Elaborate a little bit more about what that means.
Yeah, so I am a physician assistant and I'm a health educator. As far as my educational background and my business experience has been much less than that. So I didn't go to school to learn business or anything about running a practice. I just knew that I wanted to practice medicine in a little different way that allows me more time with my patients, take a little deeper dive, get to know my patients better, and to do it in an affordable way for not only my patients but myself, because it takes a lot of money to run a medical practice, and a lot of practice owners, historically have joined the larger health systems because they just can't afford to operate singly. But the direct primary care model has really taught me that it is possible to have your own practice and to pass those savings along to your patients. But as I launched the practice 3 years ago, a little over 3 years ago, I really had no clue what I was going to do next. I just knew, okay, I need to get some patients and I need to charge them an affordable price. And I can practice medicine in my sleep, but not run a business. So I've really learned a lot about how to be a successful business owner through tons of resourceful organizations that are at least available here in Charlotte. There's so many ways that you can learn the different aspects of business just being a part of this community. I don't know how it is in other communities, but I'm just thankful to be here. Um, as I've taken advantage of the Charlotte SCORE, the Women's Business Center of Charlotte, of course,
Mm-hmm.
and various other agencies, the CVM SDC, that's the Minority Supplier Development Council. they've all really just wrapped their arms around me and help me to be a better business owner. But being in business for yourself teaches you not just those aspects, but just really who you are as a person. It makes you draw on every part of your strengths and learn about your weaknesses. Like, are you a morning person? Do you like to control everything? Are you open to new ideas? How creative are you? How good are you at managing risk? And how decisive are you, and things like that that you really don't think about when you just know in your heart that, well, I want to do business for myself.
No, I totally agree because
Mhm.
I'm on the same path. I didn't know anything about entrepreneurship when I started my first business, Pamper Us. I literally was in school for social work, and I was a social worker for 5 years. But I feel like entrepreneurship to a certain extent is like a calling. It's like I see a problem, let me figure out how to be the solution, and you kind of like trial and error into a business. Really, that's literally how
Yes.
it happens. Like so, and actually, that really is the foundation of why I started this Talk It Out show and why I started Be the Entrepreneur Consulting Agency as well. Just because I realized there is a gap, excuse me, there's a gap in minority entrepreneur education. It's just a lot of things we don't know. And I feel like it ties back to that stigma of people not liking black owned business or not wanting to use them, or they feel like the stuff that we offer are of lesser value.
Hmm.
So, with that being said, I'm always excited to have people like you on here that can show that there are ways out here to be an amazing business, be an amazing minority-owned business, and a woman as well. I'm all here for all of that. So I'm super excited to get us rolling in today's topic, so we can let the people know how they can save money on healthcare.
Yes, yes. That's huge, not only, as a individual who doesn't have an employer sponsored, health insurance plan yourself, but if you are entrepreneur enough to have employees, or you're looking to recruit employees, then that tends to be one of the most expensive benefits, second to the salary. And it is what everyone is looking for when they choose a job too, right?
That's okay.
Yeah,
They
when they
want
choose
coverage. What can
a.
you offer me? What's in this benefits package? Look,
That's right. And healthcare benefits is at the top of people's list usually.
no, I believe it, especially if you have families. I can honestly say that leaving, because I worked at the Department of Social Services, so that's a big
Mm.
infrastructure. So, and we had Cigna, and Cigna is like the gold card. Like I felt like anywhere I went, like I felt like I had the black platinum American Express. It was like, yeah, you got insurance. I'm like, yep,
Yes,
Cigna,
whip it out like,
oh, look, whipping it out.
yeah, you feel like
But
a real citizen.
yeah, I feel legit when I pull out that Cigna card. But when I left, I ain't gonna lie, I got so excited about leaving, I didn't even think about the fact that healthcare goes with my job. I
Right.
was just ready to get up out of there. So I was like, okay. And then from there, I know the first thing everybody tell you is to go to the marketplace. Go to the marketplace. But I found it for me, and I'm pretty tech savvy for the most part, found it very challenging. Just kind of how they
Mhm.
had it set up, not understanding what anything means. Like, what about if you don't know what a deductible is? Like,
Yeah.
how, yeah, those type of terms and things. I didn't, and I know that, but I know it's people out there that doesn't know what that means. So,
Hmm. Or
I
how
guess
you
for today's
compare one plan relative to the other
the
is
other,
challenging
exactly,
too. Hmm.
exactly.
Yeah.
So that's where I want to start at. Let's start at the marketplace.
Hmm.
So as you know, with the marketplace, you put in your information and they give you, all these different lists of different companies that you can use for your services. Um, have you had any of your clients talk about their experience with the marketplace? What are your opinions on the marketplace as far as how it rolls for people who are looking for health insurance
Yeah.
or
So
health care
there's a lot
coverage?
of there's a lot of different plans that have a higher deductible, and so there's a lot of out of pocket expense that you should expect with those plans. That really leaves it to you to do most of the paying for services outside of the annual physical, because the minimum essential coverage is that a plan has to cover preventive services like your annual physical. It should cover, if you're a female, it should cover your mammography each year. It should cover your colonoscopy if you're 45 and over, and things like that. But the insurance is a lot different than it was when I was your age. And you could just count on, I'm going to pay a copay when I go into the doctor. I actually remember a time when there wasn't even a copay, but you pay a copay, and then you get the money taken out of your check, in the form of a premium each pay period. And you really
Mhm.
don't think about it beyond that. Like, you don't get bills for your lab. There's no co-insurance. At least there not used to be, but now there is. And so the marketplace basically gives you that bare minimum essential coverage, usually for a lower premium if you're an individual. And then there are some subsidies that you can possibly qualify for if you have a certain lower income level. But there's a lot of people that I find that are underinsured. So they make too much for the public assistance or the vouchers or the subsidies that the government will give you, but they can't afford the higher premiums that would give you more benefits. So the things that I always recommend that people look at the closest are, how much is the premium, meaning how much do I pay each month for this policy? How high or low is the deductible, meaning how much do I have to pay before the insurance will kick in? On It used to just be like the big gun test that you would take if you had to go get an MRI or a CT scan, or if you were hospitalized or go to the emergency room or things like that. That is what applied to your deductible. But these days, your primary care visits, if you have an acute visit or you have chronic disease management, your lab is included in that deductible a lot of times. And the deductibles are very high. They can be very high. So in general, the higher your deductible, the lower the premium or the monthly payment on it. So for young, healthy folks like yourself, you might want to choose a higher deductible plan, and then you can marry that with my practice type model, which is a membership based model for the primary care piece. And the amount that you save between the higher and the lower premium is usually well over what an average membership fee is for a practice such as mine. So the national average for direct primary care, which is cash or membership based medicine, is $75. And that really hasn't changed much over the 20 years that this type of a model has been around.
That was really good information. I'm typing as you go so I can drop everything in
Yeah.
the notes.
Hmm.
But I love
And
what you talked about.
most of the time,
Yeah, go
people
ahead.
use their insurance for primary care reasons, right? Like,
Right.
and they count on the insurance for the catastrophic piece should they become hospitalized or have an emergency or have develop an illness that there's a very high expense associated with, like medications that are really expensive, or chemotherapy or things like that. If you have like an autoimmune disease like lupus or rheumatoid arthritis, and you need to pay for very expensive medicines, then having the insurance is an important thing to have that catastrophic piece. But you shouldn't really have to use your insurance for primary care. I mean, it would just be the equivalent of using your car insurance to go get gas or to get car washes or get your oil changed and things like that. Like, this is the only industry that there's such a huge money maker, and it's so expensive for basic primary care. So that's what my model is all about, is offering people the affordable, less out of pocket expense for the part of healthcare that they need the most.
And you are correct, because that was my biggest issue. Like when I was looking, I'm like, I'm paying all this. Like I got like five different, like I have like five different things I'm fighting with. Like I'm like healthy. I don't have any issues. I really just need to go see a doctor for my physical. And if anything happened, like, my ankle, my ankle was
Hmm.
hurting, so if I need to come and get it checked out, but I'm like, it's nothing that I need to spend $400 a month for, and I'm only going into the office legitly one time for the whole year. So I'm like, if you calculate that, it's almost $5,000 for
That's
one. That
right.
means I'm paying $5,000 for one visit.
Right.
One visit,
Mm-hmm.
and I ain't
And
even getting no
even if
special
you,
laughs.
yeah, yeah. So even if you have chronic health problems, which I manage those also, and so let's just say you have diabetes, high blood pressure, high cholesterol, maybe a thyroid condition, and you want to work on your weight. Um, uh, those those patients usually come to the doctor's office maybe 4 or 5 times a year and then have their annual physical. And let's just even throw in, you get sick a couple times, you catch a cold, you get the flu or something like that. Um, you really should not have to pay a lot out of pocket for that sort of care. And so, with most of the either direct primary care or concierge practices, you get 20 visits a year. Some have unlimited visits a year, and those can be either face to face. They could be a virtual visit. And unlike with insurance, if you have a telemedicine visit, you don't have a copay with that. Your membership covers pretty much everything.
And that's what I love. I know that was one thing when I got your information, I was like, this is what I need. Like, this is what I need. I need something that kind of fits me and my business needs as an entrepreneur. And I felt like, you met that, because without that, I'm not gonna lie, my access to healthcare was limited. And that's something that you kind of, that I want to cover a little bit too today is the importance of the access to care. Do you feel
Yeah.
like that because of the cost of insurance that a lot of people are going without? Like, how do you feel like the cost of insurance is affecting people's health?
Yeah, absolutely. And it's so there's really kind of three groups of people as it comes to healthcare and insurance coverage or payment for insurance. There are folks that fall below the poverty line that actually have good insurance. They have Medicaid, and that is pretty comprehensive. It's different per state how generous the Medicaid benefits are, but those folks have health insurance, they have health coverage. And then there's folks who, work for an employer or who can afford their individual insurance policy on their own, and they have both the basic health coverage, preventive coverage, and the catastrophic piece. But
Mm-hmm.
then there's this group of folks who are underinsured that is really my target audience, which are folks that have employment, they are employed, but their employer can't afford to pay for a health insurance plan because, again, it's super expensive. It's going up exponentially every year. And then there are folks who, like yourself and like myself, we're entrepreneurs. We're not linked to any employer sponsored plan. And either we're going to be able to afford it through the marketplace or through our own, revenues that we're generating through our business to be able to afford that health insurance, or we're just going to have to, be without, which is that's the unfortunate part. So I figure that I would say maybe 2/3 of my patients don't have health insurance at all, and so that really it fits the need. It's sort of a safety net model for individuals that don't have a health insurance or don't want to have to come out of pocket for the high deductible plan that they have. That they can't really use it for the primary care piece. And the importance of access to is that our business model kind of prides itself on being able to take good enough care with folks so that you don't land in the ER or the hospital or the urgent cares.
Exactly.
Yeah. So we have more of a value based approach versus volume based. So the minute you start contracting with insurance companies, then that kind of puts you on the hook for large numbers of patients that are in their network. And then it's very expensive to bill and file claims for those visits that you
Mm-hmm.
have with the patients. And so you have to hire more people chase down your reimbursements and things like that. And so this model, it gives you a more tidy group of folks to care for. That way you can spend more time with your patients. So my visits are 30 minutes to an hour versus that very rushed 7 to 10 minute visit that you get
Max, that's
when you're
that's Max. They in there. How
experiencing.
you doing? How you feeling? How your foot?
Right.
How your back?
Yeah.
You got any problems? All right, the nurse will be back. I'm like, dang, you ain't asked me
Yeah.
how my
Here's your
day went.
prescription. I'll see you in 3 months.
Right. Here, yeah, they write you a prescription. I'm like, you ain't asked me how my day went.
Right.
Was it traffic
Oh
on the
no, no
way?
time for
What's
that.
the weather?
Right. No time for that. Just how are you doing
No.
on that medication? And let me see you back in 3 months.
That's it. That's it. And I can honestly say when I came, that's one thing, like I told you, like when I walked in the door and I was like, nobody else is here. Like, I'm like, okay, like it's my time. You know what I'm saying? So I got to
Mhm.
come in, sit. I'm like, okay. So we went to the back and I think we talked like for like 45 minutes to an hour. You know what I'm
Yeah.
saying? And I've been going to the doctor all my life. Like my mom, she didn't play. We go to every annual appointment. If something wrong, she taking us. So I can say throughout my whole life, my whole little 32 years of life, I've never experienced that. And that's with having two kids, all that kind of stuff. I've never been able to really sit and talk to a doctor without feeling like, or, a physician, anybody in the medical field, and be able to feel like, let me hurry up and tell them what's up so I can get out of their way because they got 15 people in the waiting room. Every room is full. Like I remember one time I went to a doctor's office and like I had to wait in the hallway while they cleaned out a room because the person just left. You know what I'm saying?
Yeah.
I mean, those are small things, but I love the fact that I felt like when I came, I'm like, okay, it's about me. I can talk about what I need to. And I think that's something that's missing in healthcare as well. And I feel like, honestly, that's why a lot of things go overlooked. Like when they'll be like, I didn't even know I had this, or something been brewing for 2 years. I'm
Yeah.
like, yeah, I went to the doctor for 2 years and they ain't see this. You know what I'm
Well, they
saying?
only let you talk about two things. So you
Oh,
couldn't get
really?
down to your foot that was hurting, or your stomach that's been tore up for the last year. You can't really talk about that if they have to address your blood pressure and your diabetes and those things that are sort of guideline driven, and there's algorithms for it. And if you work for a health system, especially, there are definitely best practices that they make sure that they follow and have you follow so that they get reimbursed, not all the time with the healthcare outcomes in mind. In fact, there's this new sort of concept that is being applied in primary care called the social determinants of health. You probably know about that being in social, with your background in social work, that there are other things that are involved in people's home or work life that are affecting the presentation of their health or the symptoms that they're presenting to you with. And so we are supposed to be very intentional about addressing the social determinants of health, which is awesome. That's what I've always done. I've had to do that as I try and combine the health education, health promotion, and behavior change piece in with the clinical piece that I do. But it's not like they're offering you any more time to do it or much more resources, because now with the advent of the electronic health record, there's just massive amounts of data that you're having to collect for the insurance companies in order to get your reimbursement. So I just kind of use and glean from all of my experiences working in the clinical setting, working in the corporate healthcare setting, in community health centers, where there's a ton of resources that surround a patient and their visit. And then working in private practice too, to kind of bring everything together and best serve the patient in a way that honors them in a holistic way. Let's put it that way.
No, I agree. And I think that's something that's missing, especially I've been to different kind of doctor's office. Like I've been in some in like the Valentine area, I've been some on the west side. I've been in some in the university area. And, unfortunately, where your business, where the doctor's office is located, it definitely makes a difference in the care that you receive. Even
Mhm.
how, how the waiting room looks, to how they welcome you to the back, to how the rooms look. All of those things are based on where you are. And I can honestly say that, coming to one central location, then, you can ask for the same doctor, but, you can't guarantee that, because in order to get that same doctor, you might have to push your appointment out an additional 2 months. Like, I've had to push my appointment out an additional 45 days to be able to get on that specific doctor's calendar. They're
Mhm.
like, oh, you can use all these other people. And I'm like, well, I've been going to this person for like, a year. I want to go back to them. I don't want to start with somebody new. So I like the fact that when I come, I know who I'm going to see. I know it's my time. And, that's just something that you can't always get in a regular, doctor's office.
Yeah, that's the other thing that I think attracts people outside of the affordability and do I have insurance or not piece. But um, I usually start a free consultation by asking, how did you find me and why did you choose to, come here? And people will generally tell me that they feel like they're heard, that there's more time that is spent, and that they feel like I care. And that's what they're looking for in their healthcare experience. So they're looking for something a little different, and the current market is not really set up that way.
Oh
Uh,
no.
Even if
They're
they
here to
claim
shovel
they're
you
set up
one
that way.
way. Yep, they want you to go one way, because honestly, I got referred to you. If I wouldn't have been referred, I wouldn't have ever known that this was even an option for me as an entrepreneur.
Mhm,
So
mhm.
um it's just amazing, that there are alternatives, and nobody is telling you those alternatives. Like I have friends that's like, I gotta pay this or I won't have insurance. My child won't have insurance. We won't be able to go to the doctor. And so to know that that's not, and I feel like, of course, that's what they want you to think, because they
Mhm.
want you to buy insurance. So, do you feel like being a direct primary care, company, do you feel like, that you feel a lot of pressure from like the mainstream, or do you feel like anything has been affected with you doing it the way you do it?
That's a good question. I think the main challenge that I've had is that because I don't contract with insurance companies, so I'm considered out of network, my practice. I have to do my own marketing because I don't show up in a network book. You can't find me, in any of the insurance companies' list of providers in their network. And so I have to get the word out. And there's a couple of nuances to my practice because, I'm minority owned practice. I'm a physician assistant owned practice. So not every state allows PAs to own their own practice or nurse practitioners. But fortunately, in North Carolina, you can. And so I find that if I have an adversary, it would be some doctors that don't value what PAs bring to the healthcare team. And they definitely don't necessarily like that physician assistant owns their own practice because it levels the playing field, right? There are physicians that own their own direct primary care practices. The membership fee may be $75 a month. I own my own practice. My membership fee monthly is $75 a month, and that's pretty much a level field, right? So all of a sudden, their 8 years of education is the equivalent of my 2.5 years of education, and our clinical acumen and the rapport that we build with our patients is what the folks will be drawn to, right? So I always have patients that will call me Dr. Leslie. That really offends doctors, by the way. And I don't announce myself as a doctor, but they see that someone who is doctoring on them or caring for them as that person that fulfills that role. So I found that doctors sometimes can just be offended by the whole thing because we are providing the same level of care, and some folks prefer PAs over their MD when they're having their healthcare visit because we take more time. We're more interested in educating a lot of the time. So what I think that's what makes me in particular unique because I'm a health educator and a PA. And then the other thing that I think, especially in this market in Charlotte, is that the healthcare systems, both Novant and Atrium, are the go-to guys. So I do a lot of community programming. I like to be out in the community doing events and programs and education and that sort of thing. But most of the time, especially like in the faith-based communities, those organizations always look to the big guys when they want to do some collaborating and that sort of thing. So I'm just really trying to make my mark and let people know that, I'm out here. I've been in the community for a long time, and I can offer not only my services, but also the education and the addressing the health disparities that are in our community in a way that, is unique. It's a unique approach to it. So not only would I go out and do a program and provide some good awareness building and that sort of thing, maybe some screenings, but I won't leave you hanging there. I'll invite you to come and become a member of my practice, where you can have those risk factors addressed in a way that there's more time spent, there's more education, and it's, to me, a more valuable experience.
I agree. I totally agree.
Mhm.
Because, we only got one body. Once something
Right.
go down, you know what I'm saying? Once it go down, baby, it's
Yes.
down.
hmm
So,
And
and it definitely
entrepreneurs,
does. Huh?
they entrepreneurs tax their bodies. Definitely tax their bodies.
That's a fact.
We tax our bodies. We stay up late, we get up early, we go all day, we're in high energy, somewhat stress mode, and those stress hormones are no joke. They're nothing to play with. I've seen plenty of folks who are entrepreneurs that their blood pressure is sky high. They may have insomnia, they may have digestive issues, chronic headaches, difficulty losing weight, steadily gaining weight, just because of how hard it is to balance your life when you're in business for yourself.
Definitely, especially at the beginning, especially like my target market of startup entrepreneurs. Most of my clients are 0 to 2 years. So even though it does get stressful, but it's a different kind of stress as you grow your business. But
Mm-hmm.
that beginning stress of running a business is a whole different kind of,
Startup
it's a whole
struggle.
different kind of stress.
Yes, it is. Yeah. And I mean, especially if you're not everyone who is in business is a born entrepreneur. Like, I
That's a
don't
fact.
really, I used to say I'm not a born entrepreneur, but when I think about it, I used to sell now laters when I was in elementary school. Now laters and lemon heads.
Gotta get to the money.
There
Look,
you go. So
yeah,
when I had
wants
my
and
first
needs.
job when I was 16. I was in high school. I worked in the high school cafeteria. So I guess in a sense, I've always liked making money, and I've always liked being busy. So there you go. Put those two things together, and you have an entrepreneur.
Right. And you add a purpose. The purpose is the third. The purpose will be the third piece I would add to
Ah,
that
that's good.
to make it entrepreneurship. Your two things and the purpose, because I think one of the things some entrepreneurs, I would say about 15 to 20% of my entrepreneurs that I've consulted have told me, that they realize that, just from us doing the intake of what they need to do to get their business rolling, like, you know what? I don't even think entrepreneurship for me. Like, I thought I wanted to do this, but after you telling me what it's going to take to do it, I
hmm
don't even want to do it. And, I really respect those entrepreneurs more so than the ones that do it knowing that they're not ready, knowing that they're not ready, or that they're doing it for the wrong reasons. You know what I'm
Right.
saying?
I
Because
totally get
those
that.
are the ones that are like ridiculously stressed. You know what I'm
hmm
saying? And I feel like if you have a passion for what you're doing, you have a purpose, you have a love for it, then even though you are putting stress on your body, it's the good stress. You know what I'm saying?
Yes.
Yeah, it's the
Yes.
good stress.
That's what
So
gets you out of bed for,
right.
especially when I can compare and contrast because, working for other companies doing healthcare, you feel like you're helping them build their brand and you're helping them keep their lights on, and they're assigning your value to you. In fact, I had a little struggle with that at the very beginning because I didn't know how to assign my prices. Like, I was somewhere between being so humble and not wanting to seem like I'm asking too much for healthcare. But it really took me a deep dive. Like I say, you learn a lot about yourself. Is that I have basically been allowing other people to assign my value. Like, this is how much you're going to be paid for your education and your years of experience and what you bring to the table for your patients. So I had to really, process all of that. But I agree. If you're passionate about what you do and you know that this is your purpose, then it does give you that energy and that drive and that motivation during the stressful times. That is absolutely true.
And it balances you out. It balances you out. And I think if you have that in place, in addition to a good, primary care, you know what I'm saying? Just somebody that can give you on that healthcare piece, just for those
Hmm.
times where it does get crazy. I feel like actually that when I think about entrepreneur healthcare, I think about it outside of the medical part, even going to something as deep as like, therapy, all those kind of extras. I feel like they all tie to that, tied to being an entrepreneur, health and wellness. I know one of the things you
Hmm.
told me about was, that you had a focus, I think more so at the beginning, but you transitioned, but you had a focus on health and wellness, like weight loss, all the lifestyle, all
Yeah.
those type of things. What are some of the things that you used to talk to your clients about when you talk to them about lifestyle changes and health and wellness, all that kind of stuff?
Right. Yeah, so I did start off with two different memberships. One was just the basic healthcare that I talked to you about, and the other part was called TLC, Therapeutic Lifestyle Change, and that would allow me to visit with people more intentionally and help them to meet their goals. So I like to move people beyond being ill or having a health problem that they're taking medications for, to feeling uh, optimally well. Like, I want people to get off of meds if they can, and everyone has most people have the opportunity to exchange those medications for some sort of a behavior change. And though it does take more work, I think we've all been kind of somewhat disconnected from our bodies because we have been engaged in this healthcare experience where we're conditioned to present with some symptoms. And then the medical model says, oh, you have these symptoms. Well, this is the medicine that you need to control those symptoms, but it doesn't fix anything. And so I really rather had an epiphany along the way that, I think that it would be more valuable to spend time with people just working on some basic pillars of health. And you have to remind people of that, again, because we're all just so conditioned to live a certain way, to eat however we want to, not really exercise, don't manage our stress, or we mismanage it by overdoing certain things, over shopping, over eating, over drinking, over smoking, just whatever it is, to try and quell that symptom that we're feeling. So what I do is to go back and kind of connect the dots with, oh, okay, you're having headaches. Well, how are you sleeping? Are you digesting your food appropriately? Like, are you having regular bowel movements? I talk to people about the coronavirus and how they can boost their immune system, not necessarily knocking the vaccine, but I've said since the very beginning, like, what are you going to do to take care of yourself so that your immune system has the best resilience and ability to fight whatever you come into contact with, whether it be the coronavirus, the influenza virus, or any other thing that is infectious in the air. And so and I'm going to write a book. I'm going to be like you when I grow up and do an ebook. I'm working on it. I'm working on it. But
Yeah,
there are
good.
some there are some basic pillars of health that need to be revisited, so that and they're true for everyone. And so I always try and focus on those. They have some to do with getting proper sleep, getting proper hydration, um, managing your stress, making sure that you are minimizing inflammation and pro-inflammatory things that you consume or you're exposing yourself to. Having proper relationships, somewhat balancing it out if you can. And so managing your emotions and things like that. So all of that is true for everyone, and especially entrepreneurs, because again, it's just so challenging trying to juggle all the balls and be everything to everybody and still have, time to devote to your business so that you're doing great in that area too.
You spoke a word on that last part. It is a lot. It is a lot, especially if you're a type of person. Like I know for me, I try to give like 100% to everything I do. Like before I make a commitment, whether that be with business, work, sports, my kids, significant others, like I'm like, all right, like how much can I really devote into this? And it's been times like where certain things I've had to cut off and remove because I just didn't have the time. And for me, and one thing that I try to talk to my clients about is if it's causing you stress, it's not worth it. And when I say stress, I mean bad stress.
Right.
Because I've had clients that were doing so much that they couldn't sleep. Like they're having insomnia because their brain is up and running. Now, for me, sleep ain't never, I sleep hard. I sleep long. I take naps every day. I take a 30-minute nap every day. You know what I'm saying? And those are just things that I incorporated because I know that I'm getting up at 5. I know I have 2 kids. I know we're active and I know I'm not going to bed till 11. So it would just be crazy for me not to take that time. And I have entrepreneurs that like are not doing it. Like they're working so crazy. And I don't, and I say, and when I talk to them, I tell them there's nothing wrong with having like an intense working time period. Like when I was dropping my ebooks, like I was doing 4 to 11. I was getting up at 4, 11, and I did that every single day for like 45 days. Now, after I finished, I was going. Like it took me like a week of recovery. I slept for almost a week straight, but I was willing to make that sacrifice for that little bit of time to get what I needed done. But I had clients that I was consulting, and they were living like this every day. Like they were getting up early, going through the whole day. They weren't even taking a nap. Some of them weren't even eating. Like they would kind of just snack. Like, oh yeah, girl, I grabbed a little snack bar, or I grabbed this. I'm like, you're up and you're active. Not only are you up, but you're active for almost 16 to 18 hours a day. And you've only had an intake of about 600 calories. You're not going to make it.
Yeah.
You are
Your
not
body will
going to
speak.
make it. Yeah. People don't listen to their bodies. That's another thing I talk to my clients about is like listening to yourself. Your body is the number one indicator of anything being wrong. If
Right.
you're starting to have frequent headaches every day and you've never had headaches before, your body is telling you something. You know what I'm saying?
Right.
Body aches, all those type of things, it all tie to stress, and people don't even realize it. I feel like we've kind of been, I don't know, it's kind of like people just kind of overlook those things. Like, oh, I got a headache. Everybody has a headache. You know what I'm saying? Or this is going on, not knowing that these are signs that your body is trying to tell you that something needs to change in order for you to be an effective entrepreneur.
Yeah. Or even if you go into a traditional medical setting and you complain of a headache, what we typically have the tendency to do is to make sure it's not the serious, a brain tumor or something that we're missing, right? Because we don't want any litigation for missing something serious that's causing the headache. And then we may ask a few questions, but we only have time for a few questions. And no one has time to say, well, we can be somewhat afraid to say, well, how's your work life doing? Or, if we even know you have a business, oh, okay. So how's the business going? Like, are you getting proper sleep? Are you hydrating yourself? Do you have anything that's stressing you out right now? Like, there's so many things that you miss when you have a really quick office visit. And so that's the thing that I love the most about this particular model is that you have time. And I've never really been personally afraid to ask people, what's going on in your life, because you don't have to have an hour-long discussion to get to the heart of someone's issue either.
Nope.
And it may just be one little pearl, or maybe they just need to talk about it, and you not necessarily offer them anything, because most of the time, and this is what I counsel people on, is that even if you go to therapy, the therapist, a good therapist, won't say too much. They will maybe ask a provocative question or something that makes you think about it, but the answer is within you, and that's where the solutions come from too. So it pays to be a good listener, and it's really I think something that we have to get more comfortable with is not being afraid to show up with your list of concerns, and don't apologize for your list of concerns. If you do have a traditional doctor that you see, and that's the whole thing, that you're paying them to make you well, and we I think
That's their
we just want
job.
to
Look,
forget
that's their job.
that's their job, right? So don't let them off the hook. I might have some folks that'll be mad at me, some doctors that'll be mad at me for saying that, like, oh my gosh, don't tell them to bring their list. No, that's what you want to do, because
That's what we paying for every month.
that's what they're paying for, and that's what you signed up for when you said, when you took your oath.
I agree. So I know that you are located here in Charlotte. So
Mhm.
your practice is located here, and I call it Alpha Wellness, but give me the whole full legal name.
It's Alpha Health and Wellness, DPC, stands for Direct Primary Care, PLLC, if you're at the government.
Right, right. Alpha Health and Wellness, PLC.
PLLC.
Yeah, two L's. Yeah, we just said we government. Got you. Um, and so I'm gonna share that. So anybody, I know that you're located in Charlotte. So your
Mhm.
direct care program that you have, um, is you said it starts at $75 per month.
Well, that's
And
the national average. My membership, I do see newborns. Uh, in fact, I have a little newborn, little pumpkin, little Benny. He is just the cutest thing. He came to me at 7 days old, 4 days old, I think he
oh,
was.
he was fresh,
So
fresh.
I take my pediatric memberships up to age 17 are $29 a month. The adult memberships are $89 a month, and I see adults all the way to age six. Well, all the way to age 64 or beyond if you don't have Medicare. If you have Medicare, then I don't accept Medicare. And there's this whole opting out thing that direct primary care practices have to do. So I have a waiting list for Medicare age patients. Um, but the family membership, if there's two adults and two or more children, then that's $200 a month. And that allows you up to 20 visits each year with no copay. And that can be face to face visit. It could be a virtual visit like a Zoom or a Google Meet. It could be, for some people, they just like to text me something really quick they want to know about. I have a patient portal that is secure, and you can do that. Sometimes I'll FaceTime, or somebody can upload a picture of a rash or a red eye or something like that. So I have whatever people need. I kind of meet people where they are. And also the routine labs are included. So anytime I'm checking your liver, your kidneys, your red and white blood cells, your blood sugar, cholesterol, things like that, that is included. For the women, the annual pap smear with HPV co-testing is included. Men, the PSA for prostate cancer screening is included. And then also I do the occult blood screening for colon cancer, and that should be done every year in between colonoscopies if you can get one, or in lieu of one if you can't afford a colonoscopy. So I try and make it pretty much as inclusive as possible and as affordable as I can.
No, you can't beat that $200. And then I'm like, kids, I'm like, okay, I gotta keep this in mind. I gotta make sure I keep this in mind.
Yeah.
So you
And I
are
also
located in.
have some
Oh, go
savings
ahead.
for medications too. So there are some pharmacy membership plans that I can introduce to people, and some cost savings if you have medications as part of your healthcare costs too.
Y'all, she your one stop shop. Like if you
I
don't,
try to
if
be.
she
I
is
don't
your
want you
one
stopping in
stop.
the urgent care or the ER. That's for sure.
Right, right, right. I love it. I love it, guys. You will not find these prices anywhere else. I'm going to, if you are in Charlotte, if you are an entrepreneur that is looking for that healthcare coverage, I highly suggest Miss Leslie. I am a client. Like I said, my experience with her was amazing, which is why I invited her on here today. And we gotta take care of ourselves. Like, I've seen so many entrepreneurs just out here working themselves to the ground. But we have to take care of ourselves. And
Mhm.
you cannot beat $89 a month for adults, and you can't beat $29 a month for kids. You know what I'm saying? Like everything you need in one plan. If you have a family, $200 a month for a whole family of four to be able to come and get services. And that
Mhm.
includes, like she said, your routine labs. She writes prescriptions, family planning, pap smear, prostate screening, everything you literally need is all in one place. And of course, she's minority. Gotta love that. And she's located in Charlotte. So if you are an entrepreneur in Charlotte, make sure you stay tuned. I will be posting her flyer on my page. I will be sharing it. That way you guys can see everything that she kind of offers all in one place. But if you are out here uninsured and you need that protection, Miss Leslie is the person for you.
I'm also licensed in South Carolina.
And South Carolina. So if you're in South Carolina, Miss Leslie got you. $89 per month for adults, $29 per month for kids. You get everything that you need to be able to stay healthy and maintain a healthy lifestyle as an entrepreneur. So, Leslie, like I said, you are in Charlotte. So, is there ways
Mhm.
that people can find, and you can serve South Carolina as well, that they can find physicians or direct care models in their area if they're not in Charlotte? Or do
Um,
you know that?
there is, if you go to um, dpcfrontier.com, that's dpcfrontier.com.
Hmm?
There is a DPC Doc Finder map. It's a national map.
Okay.
There's also another, let's see, there's a network of direct primary care practices called Access Healthcare Direct Network.com.
And say
They
that one
have
more time for me.
it's Access Healthcare Direct Network. So if you Google that and go on there, I'm on their DPC Doc Finder, and they have a national map as well. Um, if you are wanting to have a catastrophic health plan and you want to marry direct primary care for the primary care piece with it, then there is a health share organization called Sedera. That's S as in Sam, EDERA, Sedera Health. And I am in their provider network, in their DPC provider network. They're very DPC friendly, and they pay a portion of your membership. So you
Mm.
could really have the whole wraparound services in with the DPC if you wanted to have health insurance. So I don't discourage people from not having insurance because you may have something that you need that I can't provide. But in the meantime, or if you want that option, then there are health share ministries, health sharing organizations that kind of work like insurance, but it's for catastrophic needs.
No, I love it. I love it. This is all really good information. Like I said, once we get off, I will share your flyer, which brought me to you. And if you're looking for that healthcare coverage, y'all, you can't go out here unprotected because if something happens, that's the last thing you want to do is be waiting to the last minute to kind of try to huffle up somebody when you can have somebody that's on your side from the jump.
The quickest thing to break the bank is to have a
Right.
health problem, a health crisis that you weren't expecting. And yeah, so.
I totally agree. I
And I do
totally
offer a
agree.
free consultation as well.
Okay.
I wanted to throw that in there.
Yes, free consultation, guys. So if you just want to hear Miss Leslie out, see what she can do, what she can offer, then please make sure that you set an appointment and let her know that Be the Entrepreneur sent you. If you in the comments area, you will see where we have her information. We also have her membership option, and I'm going to remove this. You can also follow her on her Instagram at AHAWD Paul Cat. And if you follow her on there, you'll be able to get connected. And also, like I said, as soon as I get off this live, I'm going to post her amazing flyer. And hit her up, man. She literally has what you need. And it's nothing like having somebody that actually cares about you and not like what you can bring for them or the money or the time, but they really care about your overall well-being. So Leslie, is there anything in closing that you would like to share with our audience today, about healthcare, anything like that you want to close out with?
Well, what I will say is that this pandemic has really brought to the forefront how important it is to have care and access to care, and how important it is to rein your risk factors in and minimize or eliminate them as best you can. And my many years of doing behavior change and health education, health promotion tells me that people usually need a partner in that, someone that can give them some sound advice and some accountability, a little coaching along the way to help really them to get to their goals. So now is the best time to have health care, and direct primary care is the most affordable way that I think you can get it done.
I agree. It works for me. I love it.
Twin Brandy.
Yes. So, guys, we have our giveaway coming up next. If you are watching live, you will have the opportunity to get a free consultation session with me, 30 minutes to pick my brain about anything entrepreneur related. Whatever you have, if I don't have the answer, I will find the answer. But if you go to our website at www.betheentrepreneur.com and you subscribe, you'll get our straight to the market checklist, which is our 8 steps to test your new business idea. Because the worst thing that you want to do is jump out here and start a business and then realize after you invested all the startup money that there is no market for your business. So for free, just for subscribing at our website, you get access to our 8 steps to test your new business idea. These are all cost-efficient ideas that are perfect for startups. And then just make sure that before you invest that time and money, that you know that this business is a feasible and valuable business that can help you, that you can grow into an amazing business, quit your job, retire, live on the beach, whatever your dream is. We want to make sure that your business is set up to provide that for you.
That is awesome.
So
you're a bad mama, Tim.
Thank you. This has been a long time coming and growth, but I'm so grateful. God is so good. And, I've been working really hard and staying focused, and I definitely see the fruits of my labor.
I love it. I'm telling everybody about you. I have.
Thank you. Yeah. So to get our giveaway, all you have to do, and like I said, our Talk It Out giveaway gives you a free 30-minute consultation. So all you have to do is go to our Instagram page or our Facebook page at b.d.entrepreneur. Share any of our posts. I don't care which one you share. Just share one of our posts to your page. Tag us in it. The first 2 people that do that, you get a free 30-minute consultation. So if you've been thinking about starting a business or you already started, you're stagnant, you don't know what your next move is, I am definitely here as a resource for you to help you grow and expand your brand. But without further ado, that is our show for today. Make sure you stay tuned because our next session in 2 weeks, we're going to be talking about how to buy a house as an entrepreneur. I get that question a lot, because being an entrepreneur is definitely different than, working for somebody and having that W-2. So we have an amazing real estate agent that's going to be on, and she's going to let you know what you need to do as an entrepreneur to prepare for that home buying process. So if you have not subscribed, make sure you do so at our website, www.betheentrepreneur.com, and tune in next session. Thank you so much again, Leslie, for joining us. I really appreciate you. Today was amazing.
Thank you. This has been great. I'm like your newest fan.
Oh, thanks. Girl, you making me blush. Look, you can see it.
Thank you so much for having me and for believing in AHA.
No problem at all. Well, you guys have a great night, and I will see you in 2 weeks. Bye.